Okay, so what is therapy and what therapy is not is where we're moving into. Next slide. So the most important thing that I think is to know about therapy is that it is a safe and confidential space. One of the most beautiful things about therapy is that you're able to go into this secure environment that's super safe, that's super confidential, as it should be. And you're able to pour out your thoughts, your feelings, and kind of be expressive of some of the driving forces for you in your decision making, whether that's for your family, whether that's for your career. It's a safe environment. It's a place where healing happens. It's a place where growing happens. It's a place where self-improvement happens. And you gain the support that you need in decision making. So the number one thing I would definitely say is a safe and confidential space is what therapy is. Next slide. Therapy is also an environment where you get a partner for life. It's not a place where you go to be fixed. I think that that's one of the misconceptions, is that you go to therapy to be fixed. Someone's there to fix all your problems and answer all your questions and solve all your problems, and that's not exactly what therapy is. Therapy is a partnership. You get a therapist, and your therapist stand alongside you and support you in making decisions, support you in how you think and how you process things, and support you in your personal development. I would say that's what therapy is. Next slide. Therapy is also for growing people. I think there's a notion that therapy is for people who are weak, or therapy is for people who are insane or crazy, or who don't have anyone else to talk to, but that's also not true. Therapy is for growing people. If you have a pulse, therapy is for you. If you have breath in your body, therapy is for you. The way that I like to explain what therapy is used for is, I like to call it like a place where you can improve your soul. And to me, a soul is your mind, your will, and your emotions. Your mind, the way that you think, the things that come to your mind, the ruminating thoughts, whatever is in your mind, therapy is there. A therapist is there to support you in your thought process, to kind of put all of your thoughts on the table and kind of sift through the thoughts and process ways to properly navigate your thoughts, your will, the way that you are driven to make decisions. That's your will, right? Therapy is also a space where you go in if you're unsure about decision making, you're unsure about next moves, or you're going through a transition and you're not sure about next steps in this transition. The driving force behind that, therapy provides a place for conversation about what your driving forces are as it comes to making decisions. And your emotions. How do you feel? How do you feel about what's going on in your life right now? How do you feel about that relationship? How do you feel about that job? And so I like to call therapy a space for soul improvement. You can always improve on the way that you think, and how you navigate your thoughts. You can always improve on the way that you navigate your decision making, and you can always improve with managing your emotions. Next slide for me, please. Okay, so this is what we're here to really talk about, is what to expect in therapy. It looks like, let me go back to the chat. It looks like we have some comments about therapy. Therapy is something that helps me. Yep. When I hear therapy, I think about getting help with serious past problems. Absolutely. Okay. Okay. So what to expect? Has everyone been to therapy? Has everyone tried therapy? If you've tried therapy, just put yes in the chat. If you have not tried therapy, put no in the chat. No, not yet in the chat. Yes, so we have some to all are familiar. Do we have any providers in the building in the chat? If you are a provider yourself, could you put that also in the chat? No, not yet. Okay, as the answers come in, let's talk about what to expect. So it looks like majority of you have already done therapy, so you already know what to expect in therapy. So we can briefly go through this. But the first thing to expect is that you will meet a therapist and or counselor, depending on which direction you go. And a therapist or counselor, both are licensed professionals who help guide you in this soul improvement that I talked about earlier. What therapists or counselors are not is that we do not make you crazy. We do not force you to do things you do not want to do. We do not fix or change anyone. That's not our job. Our job is not to do that. And we also do not force medication on anyone. I think those are some of the things that people are afraid of when they're hearing about going to therapy or being suggested therapy. Our job is not to make you take medicine. Our job is not to make you crazy or fix your problems. But in the first session, you will meet with your therapist. That is the person, the licensed professional that is going to be walking with you, partnering with you as you walk through whatever it is that you're experiencing. Next slide. In this session, once you meet your therapist, you will be, you will have a space where you're able to present your concerns and the things you want to get out of therapy. Personally, generally when people first come in to see me and chat with me, they have no idea about what to even think about, to even have as a goal, right? They come in, and of course one of the things we ask is like, okay, what brought you here? What are your presenting concerns? And majority of the time they can give a brief synopsis of their presenting concerns, but majority of the time they also don't know where to go from their presenting concerns. So if you go to therapy, you already know that that is one of the things that we desire to have is a goal. Like we want to see some progress. And in order to see progress, we have to know where we're going, right? But if you've never done therapy before and you're wanting to go to therapy, it's not a huge deal that you are unsure of what you want your goals to be, because that's also why we're partnering with you as therapists or counselors. In that session, you're presenting your concerns, you are presenting what you desire to achieve, and then we also go through some background information. You are never forced to give more information than you desire to give. Never, ever, ever. However, it is encouraged that you give as much information as possible, even if it's things that you've never told anyone. That's a good space and a good place to start to open up about some of those things. I would like for soul improvement to be what rings in your mind as we go through this presentation, because I think that that's the best way to put the goal for therapy: to improve yourself, to improve your emotional being, to improve your decision making, and to improve your the way that you think and how you navigate your thoughts. And so if you've never done therapy before, I think soul improvement would be something that you can hold on to when you're ready to go into therapy, and that can be a goal that you have going into it. Next slide. In the therapy session, first therapy session, you're meeting your therapist, you are voicing your concerns and talking about the goals that you have. And then our job as therapists is to be active listeners and build rapport. Okay. So it's okay and absolutely normal to be nervous in your first therapy session, which everyone's done therapy before. So we've already got the first session out the way. Well, mostly everyone. But if you haven't done it before, it's totally normal to be nervous. It's totally normal to be unsure. It's our job as therapists to set an environment safe for you to feel comfortable. Like I said before, you don't have to express everything in the first session. We would love for you to express everything in the first session, but if you're not yet comfortable, it is our job to be active listeners and to support rapport building. Just make you feel as comfortable as possible, and the more comfortable you feel, the more things will just kind of flow. On many occasions, people come in and they are like shocked at how often they talk or how much they talk. They are like overwhelmed by the fact that they're talking so much because they came in, they didn't know what to expect, they were nervous, they didn't know who they were meeting for the first time, and things just started flowing out of their mouths. Like they're just talking and talking and talking and talking to the point where they're almost apologizing oftentimes because they didn't expect to talk so much. But I think that it is our job to create a space where you feel like you can talk and talk and talk and talk and say the things that you didn't even expect to say. So that's what you can expect in a therapy session. Next slide. The therapeutic relationship, as I mentioned before, it is our job to build rapport. And it's okay for it to be a challenge to talk and open up with your therapist. It's totally normal to do that, but we are your partners. We are on your side. We have no biases. We have no judgment. It's hardly anything that you could say that would surprise us or catch us off guard. But one of the things I always encourage, and I even say it to every patient that I see, that if you feel like you cannot get comfortable with me, let us know, let me know. Because if you feel like you cannot get comfortable with me, I would prefer that you give someone else a try rather than completely quitting therapy because you feel uncomfortable with me. Now, I only see one not yet in the chat. Was there anyone else who has not yet done therapy before? And for the ones who have done therapy, tell me what reason you continue to go. What was it about your therapist or your counselor that caused you to want to continue therapy? If you could drop that in the chat. Yes, that's a good question. What if I do not feel a connection with my first therapist? Can I try another one? Yes, I encourage every patient that I see for the first time, I encourage them to tell me if they feel uncomfortable because I also can refer them out to someone else. I, I believe that we all have the same motive as counselors and therapists, that we just want to see you well. We want to see you reach every goal you have for yourself. We want to see you improve in every way that you want to improve. And so if it's not me that can help you, then we want to refer you out. And that's totally fine. I've never actually had anyone share that they were uncomfortable with me and wanted another therapist, but I definitely put that on the table, and it's totally okay to have that experience. And people do have that experience. I have had people come to me saying that their previous therapist and they just didn't click. It just didn't work out for them. And so they stopped for years on end until they decided to return again. And so, yes, that was a good question. I think that it's totally okay to try another one. And we would prefer that you try another one than to give it up completely. Do you believe that the client connection with the therapist is important or not? If after first, absolutely. I think I just answered the same question. I think it's super important that the connection is there. If you don't feel connected, you're not gonna want to open up. That's with any relationship dynamic. That's with your parents. That's with your friends. That's with your children. To you, if you don't feel connected, you're not gonna want to talk. You're not gonna want to share. You're not gonna feel liberated to do so. How is trauma dumping during therapy? Not okay. Able to talk. Absolutely. Transformation is important. How is trauma dumping not okay? I get that question in so many different ways. I don't think I've ever gotten that question that way. We are trained. We get the education, we get the experience. And one of the things that comes with training as a therapist is that we learn that how to care without carrying. So especially for me, I think we all do, though. We learn how to care without carrying it. And I think the longer that we've been therapists or counselors, the easier it becomes. And even sometimes some topics or some trauma dumping can be overwhelming. But I think that that's why even with therapists, I believe that we all can use therapy, because there are times where it can get really heavy and not be as okay, even for a therapist. Next slide, please. The process of change. I want you to finish this sentence for me in the chat as we go to the next slide. Yep. So if you would finish this sentence for me in the chat. Change feels like blank. Change feels like blank. So the process of change, you meet your therapist, you begin to go through some of the things you want to improve, some of your goals, rapport is built, all these things, all these nice things. And then we get down to the process of change. And what is that? The first step of the process of change is awareness. Naming and understanding the problems. As I mentioned before, sometimes you come in and you don't really know what the problem is, or you can say, what you were referred for, but you don't really understand the depth of what that means. The first step that happens in therapists is we help you understand and recognize what's going on. Let's say you had a doctor's appointment and you were telling your doctor that you have these heart palpitations and you get sweaty and you get jittery and all these symptoms and you don't know what's going on. Your stomach aches, your head hurts, and it's only when it's time to go to work and your doctor says, maybe you should try therapy. You get to us, we go through the background information, all that good stuff, and then you say, well, my doctor suggested therapy because I was sweaty, I had sweaty palms, I was jittery, my stomach hurts and my head hurts when it's time to go to work. It's our job to identify that, hey, that sounds like anxiety. That sounds like you get super anxious right before work. So that's naming the problem, right? Naming what's happening. Even if you don't have all the words, maybe you have the symptoms. Maybe you know what goes on with you, even if you have no definition for what that is. And so a lot of the initial work is let's understand what's happening. Let's put names to what's happening. I believe ADHD and autism right now, people are being diagnosed with the two more than they've ever been, but they always had the symptoms. So they always knew that, they lacked focus or it had the just impulsivity. They always knew the symptoms, but they didn't have a name for it. But then they are now being diagnosed, which gives them a name for it, which then puts them at ease, right? So naming and understanding problems is so important because it can put you at a place where, okay, at least now I know what's going on with me. At least now I know I'm not misunderstanding that these symptoms are really a thing. So that's step one. The next step in the process of change is insight. We identify and name or understand and name what's going on, what's happening, and then we gain insight. So that's finding the patterns and finding the triggers. So maybe you don't know when your hands are sweaty and when you get the headache and the stomach ache, and you know it happens, but you haven't really identified when that happens, but you know it happens. You may come in with that information and we say, okay, do you notice it when you wake up in the morning? No. Do you notice it when you're going to bed at night? No. Do you know? And this is not as simple as a process as I'm making it sound, but we go through the steps and have the conversations, as many conversations as possible, to say, okay, let's identify the fact that you are becoming anxious when it's time to go to work. Why are you becoming anxious when it's time to go work? Is it a coworker? Is it your boss? Is it your People pleasing. Is it that you're such a people pleaser that you get so anxious about work because you want to please everybody at work? And so after awareness is insight. So we have conversations about, okay, what are the triggers? What are some patterns that we see these symptoms happening the most? And that's another step in the process of change. And so the next step in the process of change, as we go to the next slide and I look in the chat. Change feels like growth. Change feels like moving forward. I love that. Michael, seeing perceptions of the past, hope for the future. I love that. Okay, so the next step is action. Action is learning new tools and coping skills. Action is the absolute hardest part of therapy. It's easier to identify and be aware of what's going on. It's easier to get to a place where we find our triggers and what's causing what's going on. Action is the absolute hardest part. In the chat, if you believe that change is easy, actually making the change is easy, please put yes in the chat. I do believe so. If you know that change is hard, please put change is hard in the chat. I would love to see your perspectives. Action is, from my perspective, definitely the hardest part. Learning the tool can be easy. Doing the tool is the challenge. Implementing the tool is the challenge. You can have a toolbox of all of these wonderful coping skills, and as soon as something happens where you know you should be using your coping skill, every tool in the toolbox disappears. You don't even know what to implement. You don't know what you don't know, because the action part is a challenge. It is a huge challenge. But that's why we're here. Now, I have had people on multiple occasions be super frustrated because they're like, okay, we went through the awareness part, we went through just understanding my triggers and all of that, and now, and we talk about it in the session, but when I get home and I'm triggered, all of that goes out the window. I don't have you here at my house to help me through this. And so I said that to say action is a challenge, but action plus practice is how the change happens. Very hard. Change is hard. Change is extremely difficult. Hard, absolutely, all of that. But action is what we also work through in therapy. A lot of times, this is where we stay for a really long time. We stay at implementing the tools, using the coping skills, knowing when to use what tool. Action is about implementing new tools, coping strategies, and setting healthy boundaries. Setting boundaries, another hard thing, is another hard thing. And so a lot of therapy is supporting the action, the learning new tools and coping skills. Okay, Michael, prayer and determination. Absolutely. Next slide, please. And then maintenance. Okay, there are many occasions, many success stories, many people very like Michael who gained the victory, where we know how to implement our tools and we get to a place where we're like, yes, I can finally do this thing. But another part of therapy is maintenance. Okay, applying it every single day, and also doing check-ins with your therapist consistently to say, okay, I can kind of tighten some screws on this end. I didn't do the best with this month, but I did really well the month before. So maintenance is also a part of the process of change and what happens in therapy. Next slide. Okay, so drop in the chat some of the things. What is let's say, what is like the one thing, both good and bad, that you've heard about therapy before trying it? What's one good thing and what's one bad thing that you heard about it, as we go through some of the common misconceptions? Drop it in the chat. One good thing and one bad thing you've heard about therapy. Okay, so some common misconceptions include therapy is only for people with serious mental health problems. I believe I saw someone put that in the chat earlier, that it's a belief that therapy is only for people with like serious mental health issues, people that are hallucinating or people that are, hearing things and seeing people. That's what therapy is for. Super misconception. Not true at all. Therapy, I believe, is for everyone. I believe everyone should give it a try. I believe everyone should have a therapist in their back pocket, even if it's just for maintenance. No need for a therapist when I have my best friend. There's no need for a therapist. Me and my best friend. My best friend is my therapist, or my mom is my therapist. My teacher is my therapist, or my husband is my therapist. Another misconception, that you don't need a therapist if you have someone that you can talk to. If you already have someone that you can talk to, it's no need to have a therapist. Another misconception, another thing that is absolutely not true. People can only take you as far as their education, right? So if I know nothing about electricity, except the fact that if you switch the light on and switch it off, the light cuts on when it's switched on and the lights cuts off when it's switched off. That's as much as I can give you in conversation about electricity, because that's as much education I have about electricity. And so we can have conversations about it. We can have, and I can be a good listener to you. If you want to talk about your breaker box and your light's not working or whatever the case may be, I can be a good listener, and I can even be supportive of whatever ideas you have about getting that fixed. However, I can't give you any more than my education has given me, my experience has given me. And same with therapy. That was like the worst example, but hopefully you get the example. You can talk to your family, you can talk to your friends, you can talk to your siblings and husband, wives. But there's only so far that those conversations can take you, especially when it's more serious matters, right? And not with ill intent, because I believe that your best friend wants to hear you out. Your best friend wants to give you the best advice possible. However, that's not always the case, in terms of what they can offer you. And also, best friends, husbands, wives, friends, cousins, siblings are biased. And we hate to say it, but there is a little bias when it comes to family members or friends. Therapy gives the therapist gives solution. That's also a misconception. We're not here to answer or solve any of your problems or fix you or fix the situation. We're here to support you as you determine what your situation fixed look like. And growth and healing is a personal journey. Talking about it makes it worse. I have had so many people that feels neglectful of certain conversations because they feel like if they talk about it, then they're going to be worse off. Like, I don't want to talk about losing my mom because that's just going to open wounds and I'm going to be worse off than I was before. Absolutely not true. You have to open a wound, clean a wound, properly put that wound back together for it to properly heal. If you just let it be and it do whatever it wants to do, then it's not going to heal properly. So conversation is necessary for growth and healing, even about the hard things. Next slide. There is a stigma that comes with going to therapy. It's just something that's supposed to be temporary. It's a bad look for keep going if you don't have specific. Okay, that's a good one. Yeah. Mm-hmm. And just out of curiosity, what things have you heard about having to take medicine for like anxiety or any mental illnesses, good and bad? Just out of curiosity, is behavior tolerant? Absolutely. Yeah, all misconceptions that I see here for sure. Tom, see you soon. All right. So when do we seek therapy? When should we seek therapy? Anytime you're feeling experiencing distress, burnout, whether that's in your career, whether that's as a parent, whether that's as a servant, you might serve in the community, serve in the church. Anytime you feel burnout or distress in any one of those areas, that's a good time to start looking for a therapist to have. Strained relationships, if you find that it's hard to keep relationships, it's hard to manage relationships. If you have a strained relationship, you may not have the best relationship with a parent or a sibling. That's a good time to have to start seeking therapy, even if it's marital strains. Some challenges you're having, not really knowing how to navigate it, not even wanting to dismiss the marriage or end the marriage, but just trying to figure out how to navigate certain things between you and your significant other. Definitely a good time to have a conversation with a therapist. Typically together, but also can also be individual. Anytime you're going through a transition or a loss, I am 100% supportive of any transition being a conversation to have with a therapist. That's your children are moving out, going to college. That's a transition. Or you are the college student that's leaving home and going, moving out. That's a transition. Just had a new baby. That's a transition. Just got divorced. That's a transition. Just got married. I think any transition in life is a good time to begin to seek therapy. And of course, a loss. So you lost a dog, you lost a pet, you lost a family member, a friend. And it doesn't have to be loss from death. It could be an ending. You lost a friend from the ending of a friendship. You lost a significant other from the ending of a relationship. Difficulty managing stress, anger, overthinking, ruminating thoughts, anxiety, sleep disturbances, all of these things are good reasons to begin to seek therapy. Sleep disturbances, I want to emphasize, many people today are having a hard time sleeping, and they're going to doctor's appointments and they are getting the testing done, and the doctors aren't finding anything. Like there's no reason you should not be sleeping according to the doctor's appointments. In theory, it could be a mental thing. It could be a mental health thing. You want to seek therapy if you're not sleeping well at night, especially if the doctors have done most of what they can do or all of what they can do to figure out why you're not sleeping. It may be something that you just need to sort through mentally or emotionally, and that'll be a good time to seek therapy. All of these other things as well. Feeling stuck, if you know something is different about you, or you've always felt different. Many times people come in, they're like, I know something is wrong or something is off, or I don't feel normal, or whatever the case may be. That's a good time to seek therapy. If you negate good opportunities, you shy away from, avoid good opportunities on a regular, if you self-sabotage, those are also, if you have irrational fears, you avoid people and situations, things like that are also a good time to begin to seek therapy as well. Next slide. And to sum this slide up, tips for making therapy work for you. The truth of the matter is, and I also give this spiel in the first session of every session I have, every first session, is that therapy is what you make it, right? I'm only with you for an hour every other week, or every week, or every month. Therapy is what you make it. Are you being consistent with your appointments? Are you being honest with your therapist? Are you engaging and asking questions and talking and having the dialogue that you need to have? Are you recognizing the progress that you're making and celebrating the progress that you're making? Are you having compassion? Are you being patient with yourself? All these things is what make therapy successful for you. There are times where I have had people apologize to me for not being honest with me or withholding information. And that comes with comfort as well. You know, you don't always want to share everything if you're not feeling super comfortable. And then once you get comfortable, that's when all like the truth comes out. Well, yeah, we cannot support you unless we're getting the truth, unless we're getting the vulnerability, the vulnerable parts of your story of what's happening. And so this is what makes therapy work for you is being able to be consistent and vulnerable and having that dialogue. Next slide. This is a quote that I love to say, and I love to make it known. I believe that we were not made to do life alone. No one person was made to just live this life holding on, carrying, stuffing in, suppressing, repressing our thoughts and feelings and our emotions. I believe that we were made to experience life with people who hear us out, who can get the depths of what we express and support us in that. So family, friends, yes, of course, but also a therapist. You were not made to do life alone. And where it may be hard to talk to family and friends, a therapist is a non-biased, non-judgmental space where you can express the things in your heart and your mind, to express even the deepest, darkest things. And next slide. And healing isn't about becoming someone new, it's about becoming who you were already always meant to be. Therapy brings out the best in people. Change is hard, as we mentioned before. However, change is possible. And we see change every single day. And even if it's the smallest things, we are not trying to make you someone that you're not. We're not trying to make you someone new. We're just trying to get you to be the best soul that you can possibly be. Improve your soul in the best way possible. Your mind, your will, and your emotions. If you could, in the chat, next slide, drop in the chat one takeaway and any questions that you may have in the chat. And that is the conclusion of my presentation.
Yeah, thank you so much, Dr. Chantel. We really appreciate this presentation and how much interaction you drew from it. If anybody has any additional questions, comments, etc., for our speaker, please let us know. And we'd also love to hear more about some of your initial experiences with therapy and, what kind of got you more comfortable, more used to the process. Please feel free to share some of that information. While we're hearing about some of that, I'll go ahead and let you know a couple of things. One is that if you are looking to try to find a therapist or other mental health resources in your area, we do have a helpline. I'm going to put that information in the chat as well. We also this is slightly outdated because we also have a chat feature on our website. So if you visit our website at naminc.org, you can also use the chat feature to be able to chat anonymously with one of our team members and find out a little bit more about how to find some of these resources in your area, including a therapist that might either take your insurance or have a specialty that you're looking into. So please feel free to utilize that feature. We have one comment that says, therapy is as positive as I always knew it was. So yeah, I think that, when you're first getting started, there can be some hiccups, there can be some needing to find the right person and the right fit and having some of those difficult conversations about compatibility. But once you find that rhythm, it's invaluable to have that person helping you make decisions about your life and yourself that can move you forward. So we really appreciate Dr. Chantel's expertise on this and her guidance through this conversation. And we'll send out the recording and the other information at early next week. So keep an eye out for that. Do we have any additional thoughts from our speaker today?
I'm just so grateful to be here, and thanks for having me today.
Yes, we appreciate it so much. I will let everybody know too that our next NAMI at Noon episode is actually going to be next week, next Thursday, November 20th. We'll be meeting with Dr. Tammy Moore, who is actually one of our board members and is also a licensed clinician, who's going to be talking about being a member of the sandwich generation and how caregiving for both parents and then children and grandchildren can take a toll on your mental health, especially during the holidays, and what you can do about it. So if you haven't registered for that yet, please do so. We'll love to see you there. Um, Otherwise, I hope everybody has an incredible afternoon. Thank you so much again to Dr. Chantel, and we'll see you all soon.
See you soon.